Hello everyone. Today's my topic for discussion is blood volume. So after the completion of this discussion, you should be able to know about the normal value of blood volume in healthy adults and newborn baby, and then the fraction of the blood volume which are present in the chambers of the heart, systemic artery, veins, pulmonary circulation and capillaries. Then the homeostatic mechanism that are responsible for the regulation of the blood volume. Then also discuss about the neural and humoral mechanism that affecting the basic role of the kidney in the regulation of blood volume. And in this lecture we discuss about the normal blood volume, physiological and pathological variation in the blood volume, then measurement of blood volume, regulation of blood volume and applied aspects. Normal blood volume. Total amount of the blood present in the circulatory system, blood reservoirs and organs, tissue together constitute the blood volume. In a normal young healthy adult male weighing about the 70 kg, the blood volume is about 5 liter. Normal blood volume varies from 5 to 5.5 liters in adult person and his weight is about 75 to 80 ml per kg. A normal plasma volume that is about 3 liters and cell volume is about 2 liters. And plasma volume that is about 55% and whereas the cell volume that is about 45%. So these are the plasma and that is about 55% of the total blood volume, and these are the cells and that is about 45% of total blood volume. And it is about 7% of the total body weight and it ranges between 6% and 8% of the total body weight. In relation to body surface area, blood volume which is about 2.8 to 3.1 liter per square meter. Then distribution of the blood volume. So 80 to 84% in the systemic circulation, 64% in the veins, 13% in the arteries, 7% in arterioles and capillaries, 7 to 10% in the chambers of the heart, and 9 to 12% in the pulmonary vessels. Now there are a certain variation in the blood volume and physiological variation and pathological variation. In pathological variation that includes age, sex, surface area of the body, body weight, atmospheric temperature, pregnancy, exercise, posture, high altitude and emotion. And in pathological variation there is a hypervolemia and hypovolemia. And in hypervolemia that occurs in hyperthyroidism, hyperaldosteronism and cirrhosis of the liver, congestive cardiac failure. And hypovolemia that occurs in hemorrhage or blood loss, fluid loss, hemolysis, anemia, hypothyroidism. So first of all we discuss about the physiological variation, in which first is age. So absolute blood volume is less at birth and it increases steadily as the age advances. However, at birth, the blood volume is more when compared to body weight and less when compared to body surface area. At birth and at 24 hours after the birth, the blood volume which is about 80 ml per kg body weight. At the end of 6 months, it increases to about 86 ml per kg. And at the end of 1 year, it is about 80 ml per kg. It remains at this level until the 6 years of the age. And at the 10 years, it is about 75 ml per kg. At the age of 15 years, the blood volume which is about 70 ml per kg body weight and which is almost the adult volume. So in short, in infants, the blood volume is more when compared to body weight and less when compared to body surface area. It is 80 ml per kg in infants and 70 ml per kg in adults. Then about sex. In male, the blood volume is slightly more than in females because of increase in the erythropoietic activity, body weight and surface area of the body. In females, it is slightly less because of loss of the blood through menstruation, more fat and less body surface area. Then surface area of the body. Blood volume is directly proportional to the surface area of the body and blood volume is directly proportional to the body weight. Then about atmospheric temperature. Exposure to cold environment reduces the blood volume and exposure to warm environment increases the blood volume. Then about pregnancy. During the early stage of the pregnancy, the blood volume increases by about 20 to 30% due to increased fetal mass and sodium retention. But later stages it reduces. Then exercise. Exercise increases the blood volume due to contraction of the spleen and release of the erythropoietin and production of more number of RBCs. Then posture. Standing or erect posture for long time that decreases the blood volume by about 15%. It is because in standing condition the pulling of the blood in the lower limbs while standing increases the hydrostatic pressure. This pressure pushes the fluid from the blood vessels into the tissue space. So blood volume decreases. Then high altitude. Blood volume increases in high altitude. It is because of hypoxia. Hypoxia stimulates the secretion of erythropoietin and erythropoietin that increases the production of RBC that leads to increase in the blood volume. Then emotion. Excitement increases the blood volume. It is because of sympathetic stimulation which causes a splenic contraction and release of the stored blood into the circulation. Now hypervolemia. Hypervolemia means abnormal increase in the blood volume. Hypovolemia means decrease in the blood volume. Then about the measurement of the blood volume. So blood volume is measured by two methods, direct method and indirect method. Now direct method that is used only in animals because it involves sacrificing the life. The animal is killed by decapitation and blood is collected. The blood vessels and the tissues are washed thoroughly with the known quantity of the water or saline. And this is added to the blood collected already and the total volume is measured. From this, the volume of the water or saline used for washing the tissue is deducted to obtain the volume of the blood in the animal. This method was first employed by Welker in 1854. Later, Bischoff employed the same method on the decapitated criminals to determine the blood volume in human beings. Now about the indirect method. Now indirect method that is advantageous because it is used to measure the blood volume in human beings without causing any discomfort or any difficulty to the subject. And blood volume can be measured in two steps, determination of the plasma volume and determination of the blood cell volume. So first of all, determination of the plasma volume that is determined by the two methods, indicator or dye dilution technique. Then second is radioisotope method. So determination of the plasma volume by indicator or dye dilution technique in which the dye which is used to measure the plasma volume which is Evans blue or T1824. In procedure, first of all, 10 ml of the blood is drawn from the subject. This is divided into two equal portions. To one part, a known quantity of the dye is added. This is used as a control sample in the procedure. The other portion is used to determine the hematocrit value. Then the known volume of the dye is injected intravenously. After 10 minutes, the sample of the blood is drawn. Then the another 4 samples of the blood are collected at the interval of about 10 minutes. All the 5 samples are centrifuged and plasma is separated from the samples. In each sample of the plasma, the concentration of the dye is measured by colorimetric method and the average concentration is found. The subject's urine is collected and the amount of the dye excreted in the urine is also measured and calculation. So plasma volume is determined by using following formula. Volume, which is equal to amount of the dye injected minus amount excreted, divided by average concentration of the dye in the plasma. Then second method is determination of the plasma volume by radioisotope method. Radioactive iodine is injected. After some time, sample of the blood is collected. The radioactivity is determined by using an appropriate counter. From this, the plasma volume is determined. Then about the determination of the blood cell volume. Blood cell volume is determined by the two methods, by using hematocrit value and by radioisotope method. So in determination of the blood volume by hematocrit value, this is done by centrifuging the blood and measuring the packed cell volume. Packed cell volume is expressed in percentage. If this is deducted from 100, the percentage of the plasma is known. From this and from the volume of the plasma, the amount of the total blood is calculated by using the formula. Blood volume is equal to 100 multiplied by amount of the plasma divided by 100 minus packed cell volume. Then the determination of the blood volume by radioisotope method. Volume of the blood cell is measured by radioisotope method also, and radioactive chromium is added with heparinized blood and incubated for 2 hours at 37 degrees centigrade. During this time, all the red blood cells in the blood are tagged with chromium 52. Then this is injected intravenously. After giving sufficient time for mixing, a sample of the blood is drawn. Hematocrit value is determined by measuring the radioactivity in the blood sample. Radioactive iron or radioactive phosphorus is also used for determining the hematocrit value. Then regulation of the blood volume. The various mechanisms are involved in the regulation of blood volume. The important ones are renal mechanism and hormonal mechanism. Hypothalamus that plays a vital role in activation of these two mechanisms during the regulation of blood volume. Now when the blood volume increases, the hypothalamus that causes loss of the fluid from the body. When the blood volume reduces, hypothalamus helps in the retention of the water. Hypothalamus that regulates the extracellular fluid volume and blood volume by acting mainly through kidneys and sweat glands and by inducing thirst. Hypothalamus that regulates the water content of the body by two mechanisms, thirst mechanism and antidiuretic hormone mechanism. So first of all, thirst mechanism. So thirst center, which is, thirst center is in the lateral nucleus of hypothalamus, and there are some osmoreceptors in the area adjacent to thirst center. When the extracellular fluid volume decreases, the osmolarity of extracellular fluid is increased. So if the osmolarity increases by 1 to 2%, the osmoreceptors are activated or stimulated. In turn, they activate the thirst center and thirst sensation is initiated. Now the person feels thirsty and drinks more water. Water intake increases the extracellular fluid volume and decreases the osmolarity. Then second mechanism by antidiuretic hormone. Simultaneously, when the volume of the extracellular fluid decreases with increased osmolarity, the supraoptic nucleus is stimulated and antidiuretic hormone is released. Then antidiuretic hormone that causes retention of the water by facultative reabsorption in the renal tubules. It increases the extracellular fluid volume and brings the osmolality back to normal level. On the contrary, when the extracellular fluid volume is increased, the supraoptic nucleus is not stimulated and ADH is not secreted. So in the absence of the ADH, more amount of the water is excreted through the urine and volume of the extracellular fluid is brought back to normal. So this is a flow chart. So decrease in the extracellular fluid volume. Then there is an increase in the osmolality of extracellular fluid. Then stimulation of the osmoreceptors in the hypothalamus. Then they stimulates the thirst center. So person feels thirsty and he or she takes more water. So increase in the volume of the extracellular fluid volume and decrease in the osmolarity of extracellular fluid. Now the hormones which are involved in the regulation of the blood volume through the regulation of extracellular fluid volume. So hormones which are antidiuretic hormone, aldosterone, atrial natriuretic peptide. So ADH. ADH secretion depends upon the volume of the body fluid and the osmolarity of the body fluids. So when the ADH is secreted. So there are a potent stimulants for the ADH secretion are whenever there is a decrease in the extracellular fluid volume. So when there is a decrease in the extracellular fluid volume, there is an increase in the osmolar concentration in the extracellular fluid. So there are two potent stimulants for the ADH secretion, decrease in the extracellular fluid volume and increase osmolar concentration in the extracellular fluid. Then role of osmoreceptor. So osmoreceptors are the receptors which give response to change in the osmolar concentration of the blood. So these receptors are situated in the hypothalamus near the supraoptic and paraventricular nuclei. So when the osmolar concentration of the blood increases and extracellular fluid volume decreases, the osmoreceptors are activated. And in turn, the osmoreceptors stimulate the supraoptic and paraventricular nuclei, which send motor impulses to posterior pituitary through the nerve fibers, and they cause release of the antidiuretic hormone. Now, antidiuretic hormone causes reabsorption of the water from the renal tubules so that it increases the extracellular fluid volume and restores the normal osmolarity. Then second hormone is aldosterone. So aldosterone that is a very essential for the life and it maintains the osmolarity and volume of the extracellular fluid. It is also known as life-saving hormone because its absence causes a death within 3 days to 2 weeks. So aldosterone has a three important function. First, it increases the reabsorption of the sodium from the renal tubules. Second, it also increases the excretion of the potassium through the renal tubules and secretion of the hydrogen into the renal tubules. So what is the action of the aldosterone on extracellular fluid volume? So when the sodium ion are reabsorbed from the renal tubules, simultaneously water is also reabsorbed Water reabsorption is almost equal to the sodium reabsorption. So the net result is increase in the extracellular fluid volume. So whenever the sodium ion is reabsorbed, simultaneously water is also reabsorbed. So net result is increase in the extracellular fluid volume. So increase in the extracellular fluid volume, the blood volume finally leads to increase in the blood pressure. So when the aldosterone level increases, there is a excess retention of the sodium and water. That also increases the volume of the extracellular fluid and blood pressure. Then third one is atrial natriuretic peptide ANP. Aldosterone induced high blood pressure that decreases the extracellular fluid volume through the two types of the reaction. First of all, it stimulates the secretion of atrial natriuretic peptide from the atrial muscles of the heart. Then what are the functions of the atrial natriuretic peptide? It causes excretion of the sodium in spite of increase in the aldosterone secretion. Then second, it also causes pressure diuresis. Pressure diuresis means excretion of the excess salt and water by high blood pressure through urine. This decreases the salt and water content in the extracellular fluid in spite of hypersecretion of aldosterone. This is known as aldosterone escape or escape phenomena. Besides the atrial natriuretic peptide, two more natriuretic peptides known as brain natriuretic peptide and C-type natriuretic peptide are also secreted by the cardiac muscle. And BNP and CNP also have a similar action of the atrial natriuretic peptide on sodium excretion. So whenever there is a increased aldosterone level, there is a reabsorption of the excess sodium and water from the renal tubule. So net result is increase in the extracellular fluid volume. So there is an increase in the arterial blood pressure. So whenever there is an increase in the arterial blood pressure, there is a secretion of the atrial natriuretic peptide from the atrial muscles of the heart. And what are the functions of atrial natriuretic peptide? It causes a excretion of the sodium and water through the urine. So there is a decreased extracellular fluid volume and blood pressure comes to normal. Then second mechanism is pressure diuresis. Whenever there is an increase in the arterial blood pressure, there is a pressure diuresis occurs. Means there is a more excretion of the sodium and water through the urine. And there is a net result is decrease in the extracellular fluid. So even though the aldosterone level is more, there is a no increase in the blood pressure. So that phenomena is known as aldosterone escape. So kidney regulate the arterial blood pressure by two ways. By regulation of extracellular fluid volume and second is through the renin-angiotensin mechanism. So when the blood pressure increases, kidney excrete large amount of the water and salt, particularly sodium, by means of pressure diuresis and pressure natriuresis. So what is the meaning of pressure diuresis? Pressure diuresis is the excretion of the large quantity of the water in the urine because of increased blood pressure. Even a slight increase in the blood pressure double the water excretion. Then what is the pressure natriuresis? It is the excretion of the large quantity of the sodium in the urine. Now because of the diuresis and natriuresis, there is a decrease in the extracellular fluid volume and blood volume, and which in turn brings the arterial blood pressure back to normal level. So when the blood pressure decreases, the reabsorption of the water from the renal tubule is increased, and this in turn increases the extracellular fluid volume, blood volume and cardiac output that results in restoration of the blood pressure. So when the blood pressure and extracellular fluid volume decreases, the renin secretion from the kidney is increased. It converts angiotensinogen into angiotensin 1, and angiotensin 1 is converted into angiotensin 2 by angiotensin converting enzyme. Then what are the functions of angiotensin 2? So angiotensin 2 acts in two ways to restore the blood pressure. It causes constriction of the arterioles in the body so that the peripheral resistance is increased and blood pressure is also increases. In addition, the angiotensin 2 that causes constriction of the afferent arterioles in the kidney so that the glomerular filtration reduces. So that result in retention of the water and salt, and that increases extracellular fluid volume to normal level. This in turn increases the blood pressure to normal level. Simultaneously, angiotensin 2 stimulates the adrenal cortex to secrete aldosterone. Now, what are the functions of aldosterone? Aldosterone that increases the reabsorption of the sodium from the renal tubules and excretion of potassium. So sodium reabsorption that is followed by water reabsorption. So that results in increased extracellular fluid volume and blood volume, and it increases the blood pressure to normal level. So this is a flow chart for regulation of the blood pressure by renin-angiotensin mechanism. So whenever there is a decrease in blood pressure, there is a renin secretion from the juxtaglomerular apparatus. Now renin that acts on angiotensinogen and converts it into angiotensin 1. Angiotensin 1 that is converted into angiotensin 2 by angiotensin converting enzyme. Now angiotensin 2 that is a vasoconstriction that causes a vasoconstriction, and it also causes a constriction of afferent arteriole. So there is a decrease in the renal blood flow. So and it comes back to blood pressure normal. And angiotensin 2 that also acts on the adrenal cortex, and it stimulates the zona glomerulosa cell, and from which the aldosterone is secreted, and aldosterone that acts on the kidney, and aldosterone that increases the sodium reabsorption, and simultaneously water reabsorption also occurs. So increase in the extracellular fluid volume, and there is a also increase in the blood volume, and blood pressure comes back to normal. So in this way there is a blood volume increases. Now the increased sodium ion concentration and extracellular fluid volume inhibit the juxtaglomerular apparatus and stop the release of renin. So angiotensin 2 is not formed, and release of the aldosterone from the adrenal cortex is also stopped. Then another mechanism for the regulation of the blood volume is capillary fluid shift mechanism. If there is an increase in the blood volume, there is an increased capillary pressure that leads to increased leakage of the fluid from the capillary to interstitial fluid, which decreases the blood volume back to normal. If there is a decreased blood volume, exactly reverse events occurs. Then another mechanism is reflex mechanism or baroreceptor reflex. So when the blood volume increases, baroreceptors are stretched and are stimulated. So there is a reflex inhibition of sympathetic nervous system that leads to dilatation of renal arteries and allowing the excess urinary output. Then about the applied physiology, hypervolemia and hypovolemia. Hypervolemia means increase blood volume, and hypovolemia means decrease blood volume. So there are a certain condition in which there is a hypervolemia occurs, and these are the condition in which the hypovolemia occurs. So hypervolemia means increase in the blood volume, and it occurs in hyperthyroidism. Blood volume increases because thyroxine increases the RBC count and plasma volume. So in hyperthyroidism, blood volume increases. Then hyperaldosteronism. In hyperaldosteronism, excess retention of the sodium and water that leads to increase in the extracellular fluid volume and blood volume. Then in cirrhosis of the liver, the blood volume is more because of increase in the plasma volume. Then in congestive cardiac failure, in this condition there is a retention of the sodium occurs. Sodium retention also leads to water retention and increase in the extracellular fluid volume, plasma volume and blood volume. Then hypovolemia. Decrease in the blood volume, that is known as hypovolemia, and it occurs in the following pathological condition like hemorrhage or blood loss. Acute hemorrhage occurs due to cuts or accidents. The chronic hemorrhage occurs in ulcers, bleeding piles and excessive uterine bleeding in females during the menstruation. Then fluid loss. Fluid loss occurs in the buns, vomiting, diarrhea, excessive sweating and polyuria. Then hemolysis. In hemolysis, there is excessive destruction of the red blood cells occurs because of the presence of the various hemolytic agents and other factors such as hypotonic solution, snake venom, acidity or alkalinity and mismatched blood transfusion, hemorrhagic smallpox and measles. Then anemia. Blood volume decreases in various types of the anemia because of decrease in red blood cell count. In some cases, the volume of the blood remains the same, but the quality of the blood alters. Blood becomes dilute, means hemodilution, because of the entrance of the fluid into the blood vessels. Then hypothyroidism. The blood volume is decreased because of reduction in the plasma volume and red blood cell count. Thank you very much.